Good morning, good afternoon, good evening, wherever you are joining me today. Thank you. Thank you for watching this video. Thank you for subscribing to the channel. It's really important that we educate as many people as we possibly can. So please share this channel with all the people within your circle. Today I'm joined by Lynn again. Good morning, Lynn.
Good morning.
Good afternoon, Lynn.
Good afternoon.
Good evening, Lynn.
Good evening.
Today I wanted to focus our attention on young onset dementia and the impact that it has on individuals and on families and the psychosocial impact that it has, because there's a big difference between someone with young onset dementia and older people who are living with dementia. So I really wanted to focus on that. And we're seeing an increase globally in young onset dementia. So I think it's really important that we do tackle this today. So I think Lynn has a few questions to get us started. So over to Lynn.
All right, so what is young onset dementia? How is that different from dementia?
Okay, young onset dementia impacts on people who are diagnosed under the age of 65. We used to say working age, but of course, people are working later and longer these days. So it is defined as a diagnosis of someone under the age of 65.
And what are the signs that you might have this type of dementia compared to just, like we're saying, with a regular type of dementia where it doesn't affect you when you're younger? How do you know that it is dementia and not just getting older or confused, finding words?
Yeah, we're looking at the same symptoms. The symptoms are the same. So I'd be concerned if somebody had an immediate memory issue, so a short-term memory problem. I would be concerned if that was accompanied by a disorientation in time and place. And I would be concerned if those two things were accompanied by an inability to follow a typical sequence of events that people have been used to following, or instructions like fastening your shoes or baking a cake, things that people are used to doing and they're finding difficulty doing now. So those three things together would be indicative that there is something that needs further exploration by a neurologist who specialises in the field of dementia.
And if you have young onset dementia, is it typically of the Alzheimer's variety, or is it vascular or frontal temporal?
It varies. I mean, not everybody has the same form of dementia. There's over 100 types of dementia. So that is a really difficult question to answer because there's so many different types of dementia. So it could be young onset Alzheimer's disease, it could be young onset vascular dementia, it could be young onset frontal temporal dementia. And I think it's important to remember that many dementias are a combination of 2 or 3 different types. So if we think about numbers, prevalence rates, so if we focus on the United States, currently there's around about 200,000 people with a diagnosis of young onset dementia. 200,000 people living with young onset dementia. In the UK, that's a little bit lower because obviously we've got less of a population, but it's around about 80,000 people in the UK who are living with a type of young onset dementia. And Canada, again, is a smaller number. It's about 28,000 in Canada. If we think about that in terms of numbers, it's quite impactful. It doesn't sound a lot when you think about the population of these countries, but it is impactful. And the socio-economic impact on that individual and their families is completely different than the older generation who are living with a type of dementia.
Does your life expectancy have an impact on being diagnosed before the age of 65 or later in life?
I think again that's individual on the person and how it affects the individual and the type of dementia that the individual has. But we've always had this rule of thumb that the younger you are when you are diagnosed with a dementia type illness, the faster it seems to progress. However, let me just add to that is not always the case. That is only a rule of thumb. I work with a number of people who have young onset dementia, and there hasn't been a great deal of change in terms of cognition and memory over a number of years. So everybody's impacted differently and individually.
So if I was reading, is this true that a lot of people go undiagnosed for many years with a type of dementia or mixed dementia? So let's say you're 70 and you're recently diagnosed. It's possible that you had young onset dementia, but you just weren't diagnosed because usually loved ones and family members can look back after a diagnosis and say to themselves, oh, I recognize there were some signs years ago that maybe led to this diagnosis. So what I'm saying is it possible that people that are newly diagnosed after the age of 65 could have had young onset?
Absolutely.
And does that make any difference?
No, you're absolutely right. I think what we're mainly talking about here is mild cognitive impairment. There are thousands and thousands and thousands of people across the globe who have a mild cognitive impairment that hasn't been diagnosed. And not always, but very often, mild cognitive impairment is the precursor for a dementia type illness or disease.
So MCI.
MCI, mild cognitive impairment, yeah.
And if they saw a neurologist who did a cognitive assessment, they would be able to tell them if they have MCI or if it's something more than that, something more along a dementia diagnosis.
Yeah, there's a battery of tests that people go through in order to come out with a definitive diagnosis. And this can include blood tests, spinal tap, where you're looking at the spinal fluid. There's MRI, functional MRI, CAT scans, cognitive function assessments, cognitive function tests. So there's a whole battery of tests that an individual will go through in order to determine where they are in terms of whether it's a mild cognitive impairment or if it's a probable Alzheimer's disease, vascular dementia, Lewy body type dementia, or any other form of dementia. So let's just think about the socio-economic impact that has, because many people are still working, and so when it becomes too difficult to work, some of these people, or the majority of people with a young onset dementia, may have rent to pay, they may have a mortgage to pay, they may have kids in college and they're funding that. So there's a whole bunch of socio-economic issues that come along with having a diagnosis of young onset dementia. And not only that, but it impacts on people's self-confidence, self-esteem, self-belief. And so there's a whole wide of challenges and difficulties that come along with having that diagnosis. And it also has an impact on family relationships, on marriage, on relationships with friends and family, And so all these issues have to be considered, all these issues have to be addressed. And it's really, really important that people do get help and support with all those challenges and all those issues that come along with having a young onset dementia diagnosis. So I want to make that absolutely clear. Please ensure that if you start to feel any of those things that I've talked about, if you start to feel, oh, I've got an issue with my short-term memory, and it's accompanied with these other things like disorientation in time and place and not being able to follow a sequence, please seek immediate help, because there is so much we can do today. There is so much intervention. There is so much pharmacological and non-pharmacological intervention that can help people through their journey. And there's lots of support systems. They are all different in the 3 countries that I've mentioned there, UK, US and Canada, but there is help and support in all of those countries. So please make sure that you do get the right help and support. And I would always recommend, if you do start to feel that there's something going on, some changes happening, go see your primary physician or your nurse practitioner and get an evaluation and get a referral to the neurologist, who is in the best place to be able to look at the issues. 55 million people worldwide have a dementia diagnosis. 55 million people. And 60% of those are in low to middle income countries. So we're looking at the Western world. You know, I really want to focus on the Western world here and think about, why are we seeing an increase in young onset dementia? We can pretty much look at justification for older people developing a cognitive challenge and cognitive change, because there's some natural aging going on. From the age of 70, we experience senescence, and so the brain changes, the physiology changes, the body changes, and so we can pretty much think about why those things happen as we age. But what is it? What's really causing it? You know, where does it come from? And there's a number of reasons, and I think I've spoken about this before in other videos. But we're living in a world where our lifestyle is pressured. We have a lot of stress and a lot of anxiety in our lifestyle. Diet and nutrition is paramount to reducing risks of developing any kind of dementia at any age. Diet, nutrition, lifestyle, reducing stress, reducing the anxiety that we experience, not putting ourselves in that position of having to achieve a certain thing and meet a certain thing. We need to look at what we are eating. Stop eating fast food day after day after day. When I'm driving out and about, I see fast food chains with queues and queues of cars every day. So really think about that, and think about the impact that eating fast food has on your health and well-being. You're putting food into your body and feeding your brain toxins that you aren't aware of. Don't know what's in there. So try as much as you possibly can to eat healthy. Try to eat organic as much as you possibly can, and try to eat as a family. There's a book called Aging with Grace, The Nun Study, N-U-N, The Nun Study by David Snowden. And this research has demonstrated that eating communally is so beneficial to our physical, mental, and psychological health and well-being that it's really what we should be focusing on. We should be striving to get back to those old traditional values of eating together as a family, eating healthy, promoting healthy food, healthy eating. And it has to start young, it has to start in the schools. People like myself and neurologists and other dementia specialists should be going into the schools and talking to children about healthy eating, talking to parents about healthy eating and the impact that that has on people. So I think there's a whole number of reasons why we're seeing this increase in young onset dementia. And we can do something as a nation, as a peoples, we can do something to address that issue. Sometimes there's nothing we can do. Sometimes there is a genetic factor. You know, there is something called an APOE4 gene, LL. And if we have and we carry that APOE4 gene, then there's not much we can do about staving off dementia. However, that doesn't mean we can't do anything, even if we do have the APOE4 gene. We can still change our lifestyle, we can still live healthy, eat healthy, exercise, focus on brain health. Brain health is so important. So many people will go to the gym and work out their body, but forget about the brain. The brain is a muscle. You know, you see all kinds of exercises out there and lots of bodybuilders teaching people how to train their body, but they never talk about the brain. So the brain is just as important as a bicep or a thigh or whatever, you know, that is so important. So young onset dementia is impactful. There are many, many people in the world living with it. And so please get help. Any help that is available, take it and work through the journey in the most positive way that you can.
And live well with dementia.
Absolutely. Nobody should be using the term suffering. If we hear the word suffering, we suffer. If we have the mindset of living well, we live well. We see dementia as just a part of who I am. Still the same person. I'm still there. I'm still that individual. I still have my likes, my dislikes. I still have my goals. I still have my dreams. I still have my ambitions. I still strive for enjoying life. And that's what living with any kind of disease, disorder, whatever people want to use, whatever term people want to use, it's about living well with. And now I see more people using that term and more people using that phrase. But I did see a commercial, you know, there's many commercials on TV for medications, of course, and I saw one about diabetes, and they used the phrase living well with. You can live well with diabetes. And then the next commercial was medication for dementia, and they used the word suffering. So I've banged on about this for years and years and years, ever since I came into the field of dementia, which was in 1992. Ever since that time, I have banged on about terminology, language and terminology. It's got to be positive. And everybody who has a cognitive change, everybody with a neurodegenerative disease, everybody with a neurocognitive diagnosis needs to have that positive outcome. And I work with many, many, many patients who do have that. And if they don't, after we've worked together for a while, they do have that. So having that positive mindset is so important. So I really wanted to get that message out there about young onset dementia, and that people can do something to reduce their risks of developing dementia. There's many, many treatments now available. There's so many things happening so fast as well, that there is so much hope for helping people who are living with a cognitive disorder. And 1992 is when I first started in this field, and it's now 2023. And there was very little help and support in 1992, but things have changed dramatically in the UK, in the US, and we have to tap into those resources.
Great. Thank you, Dr. Nightingale, for sharing that information with us. I encourage everyone who has a topic you would like to see him discuss to post that in the comments on these videos. And like you said, please share the videos with your friends and your family and get the word out that there's hope and there's a lot we can do to live well with dementia.
Absolutely. And share. Educate the masses. This is what I'm trying to do. I'm trying to educate the masses. I can only reach a certain amount of people in my work, in my practice. So by doing this, I can reach out to many people. So share, and get people to subscribe, because as you know, every Wednesday we post a new video. So thank you for listening, thank you for watching, thank you for sharing. If you need to ask any questions, please post it on the comments there on the YouTube channel, or visit my website, drdanielnightingale.com, or just contact us in any way you wish to do so, and we'll be happy to help. Have a great week, guys.